Hi there, this video talks about being more transparent as you prepare a patient for examination. I think it's useful to never forget that it is the patient's choice to be examined. To be able to consent to an examination, the person needs to know what you are going to do and the purpose of it. Now, the examination is traditionally considered to be part of the data gathering section because you are data gathering, and it certainly fits in this section with an old-fashioned model where doctor tells the patient they will be examined and then after tells them the diagnosis. I feel that it fits halfway between data gathering and the explanation stage often, as explaining why you're examining the patient will start revealing your thinking as to the cause and maybe even the treatment options. For me, the need to offer an examination as a choice and to more fully explain its purpose has become more obvious since doing so many phone call first consultations. On the phone, discussing the options of an examination can feel very much the same as explaining why I'm organising an investigation. For some people, it might not be straightforward to come in, so for example leaving work early, getting a taxi, sorting out the kids. I'm more likely when doing a phone consultation to explain my current thinking of the differential diagnosis list and then how an examination is specifically going to help with this. Sometimes it's also appropriate to examine how the examination is going to help decide on the treatment options. By the end of the consultation, you need to explain your thinking behind the most likely diagnosis, the possible alternative diagnosis, and the management plan. It's up to you to decide when and how this best fits into the consultation at the time. For example, with a phone consultation, you might be saying, your symptoms do sound like a chest infection and you sensibly wondered about antibiotics. Would it be possible for you to come in today so I can examine your lungs for evidence of pneumonia and check things like your blood pressure, pulse and oxygen levels, see how much the infection is affecting your body? You might go on to say that will help determine how bad the infection is and therefore if antibiotics are likely to help or not. In a face-to-face examination, you will usually not need to do a long explanation if the reason for the examination is obvious. Patients come into you for you to work out what's wrong with them, and mostly they expect to be examined. So for example, if someone has come to see you about their shoulder, then stating, "Is it okay for me to examine your shoulder?" is usually all that is needed before the examination process begins. You might also say, "I would also like to examine your neck, as sometimes a problem in the neck, like a pinched nerve, can feel like it's in the shoulder." So this is important because it might not be obvious to the patient why you're examining their neck, and it increases the transparency of the consultation. The more significant the examination is to the patient, the more explanation you should be giving. So for example, a patient needing to attend in person pushes up the significance. The more intimate the examination is, the more explanation should be given. And also, if the examination could be painful, the purpose of it needs to be explained. So for example, your urine symptoms that you described could be due to a bladder infection or an infection in the prostate. I think it's important to examine the prostate to see if there is any evidence of that. Is that okay? If when I press the prostate it's painful, that can be a sign of infection. So as with transparent questions, where the patient is informed about why you're asking the question, i.e. what's its purpose, if the patient is fully informed about the purpose of the examination, they are more likely to be of assistance in the examination process. With a prostate patient, if you don't tell them you're looking for pain, they might not tell you. When you are actually doing the examination, it is important to keep the patient informed to a varying degree of what you're about to do at each stage. So for example, stating, "I'm going to have a listen to your lungs," rather than just sticking a stethoscope on their chest. At no point should the patient be thinking, "What on earth is the doctor doing?" And the more you inform the patient of what's happening, the more they will understand the process, and then later your explanation of your thinking when you describe your findings, and they will make more sense. Now that is balanced with the need to do the examination in a slick and smooth way. You don't have to describe every single thing you do. You don't want the patient to feel you are stating the obvious and asking permission to do everything. i.e. you don't want the patient thinking, "I wish they would just get on with it." During the examination, You really need the patient to know what is about to happen, if it might cause pain, or if their feedback is required. So I'll go with a shoulder examination. You might say, I would like to see how much movement you have in each direction. When you or I move the shoulder, please tell me when it starts to hurt. Other phrases you might want to use are, I'm sorry that this might be uncomfortable. What I am trying to work out is, and then you say, please tell me if it is too much. So for an example, let's say abdominal examination, you might say, what I would like to do now is more firmly press on the area that you feel uncomfortable to see if I can feel a swelling of some kind. If it's too uncomfortable, please tell me and I'll stop. If you do cause unexpected pain, then you need a save the rapport statement. Hopefully you won't need this because you've been explaining your examination and you've been careful. But if you do, then a quick apology and explanation are required. So, for example, let's say you're examining for a gallbladder. Oh, I'm sorry that hurt. Are you okay? What I was doing was trying to feel your gallbladder. The fact you had pain there suggests the gallbladder could be a cause of your pain. What we've discussed so far is before each stage of the examination. It doesn't mean you have to explain your findings as you go. It is explaining what you're about to do. You can describe your findings as you go, but that depends on how well your brain is formulating what you're finding and what it means. You may find you talk out loud your findings the more experienced you become. Another reason you might also want to keep a person more informed as you go during the stages of the examination and consultation could be if the patient holds strong health beliefs, such as they definitely need antibiotics or they're worried about certain diagnosis. If you can be clear about your thinking throughout, then the person will be more likely to work out for themselves as the consultation unfolds what you believe the diagnosis or treatment plan is likely to be, rather than you announcing unexpectedly to them at the end that you've come to a different conclusion to what they thought was happening. I hope that makes sense. If you can record yourself, have a look at what you've said to prepare the patient for examination and what you are saying during the examination. Note down any good phrases to use again, hypothesize on any phrases you could have used and see if you can add them in next time. Thank you.